What's up, y'all? It's Celeste. When I first went on testosterone in 2017, I didn't think too much about the potential for hair loss. I mean, I knew it was something that could happen from taking tea, but at the time, I didn't actually think I was going to be on tea long enough for it to be a thing, because I originally thought I was going to be on tea for a very short period of time. Definitely didn't think I was going to be on it for years. So it just kind of wasn't something I was really thinking about, and for the first couple years that I was on tea, or the first few years really, it wasn't really something I needed to worry about. Before I started taking testosterone, my original hairline was pretty rounded and came forward pretty far down at the temples, and I had a decent amount of hair on the top of my head. My hair's always been pretty thick, and so I had quite a lot of hair up there. I kept it short on the sides and back, but up at the top there was a lot of hair up there, especially, like, depending on how I got it cut. So I didn't think that, like, I thought that if I started to get hair loss, that it would be very obvious to me, that it would be something that I would definitely notice and would be able to stop taking tea at that point. And that was actually one of the, like, main things that I thought about, like, if I start losing my hair, then that's one of the things that's going to make me stop tea. But that's not how it happened. It kind of snuck up on me. When I look back at pictures from, I would say, like 2022 on, I can tell that my hair is thinned out some at that point. Pretty much like late 2021, it was still pretty thick, but over 2022 is when it started to thin out. But I didn't realize that at the time. I can see it now, but there were several things that happened over that time period that made it so I didn't notice it happening. Number one was about like a year or two into COVID, when supply chain stuff was happening and prices were going up all the time for everything. For a while, they had been going up for products and stuff in stores, but there was a certain point when it seemed like kind of all of a sudden service prices went up for everything. And I think some of that was because of, like, those people needing to get supplies for the services that they were offering, and then also just like the cost of living going up because they needed to buy groceries and everything too. So at that time, my barber raised his price by, I think, $10, kind of overnight. I actually made the appointment and it was listed at the certain price when I made the appointment, and then when I actually got it cut, he charged me the higher price, and I was kind of annoyed by that. I didn't think that that was really the right way to do things, but of course I didn't say anything because I'm not assertive enough to do that, or at least wasn't at the time. I maybe would do it now. But anyway, I was kind of annoyed, so I didn't like that. I also didn't like that pretty much no one in there was wearing a mask at that time, even though on the website and, like, the listings, it claimed that they did. I didn't like that. So anyway, I decided to switch to a different barber. I tried, like, I think one or two other barbers in the area, and then I eventually just switched to going to Great Clips. And that's a little bit of a gamble because you never know who you're going to get there. You're not making an appointment with a specific barber. It's just like whoever's available. So because of that, like, I kind of thought that, because, like, I recognized that my hair looked different over that time period, but I was getting my hair cut by all these different people, and they didn't know my hair, they didn't know me, they didn't know what I wanted. Like, my previous barber kind of had gotten to know me and what I wanted. He knew, like, how I liked things. So I kind of chalked up the difference in how my hair looked largely to just the fact that I was getting haircuts by all these different people that may or may not know what I wanted, and also probably had different skill levels and all that kind of stuff. And also, even before I started going to Great Clips, at some point I started shaving my hairline into more of a square shape. I think it started when I went to a barber. It might have been the barber that I was talking about just a minute ago. It was some barber that I went to who squared it off for me, and I liked that. So I ended up, like, continuing to do that, and I still do that now. But over time, I needed to do it less and less, and I kind of started realizing that at some point. But for quite a while, I was shaving, like, this part and then across here, so kind of squared off. But it always varied a little bit, both from myself and then also from my barber and other barbers doing it. It would always fluctuate a little bit exactly where it was, so there were always differences in, like, where the line was, like where my hairline was because of that. I mean, they were pretty minor, but it did make my hairline look different depending on how it was trimmed, basically. So that was another thing. I thought maybe it was just like because of that. It's not even like I thought like that I saw my hairline and was like, wow, it looks thinner. It must be because of this. It's just that I didn't think about it being thinner. It's just that it looked different, and I just kind of thought it was because of these other reasons. The way that it thinned out was sort of diffuse, and it wasn't like I had these like big bald patches or anything. There was still enough hair there that it kind of looked like normal amount of hair. But at some point in early 2023, I did start to notice that I had some thinning around the crown of my head. And so I kind of panicked about that and ran out and got some liquid minoxidil, which is basically this substance that you can apply topically to your scalp that causes your hair to grow more wherever you put it. And I'll get more into more in detail on minoxidil later on. But I didn't like it. It kind of made my hair greasy, and it's a little hard to apply because you are trying to get it onto your scalp, but not really onto your hair. It's not going to hurt anything to get it on your hair, but that's not where it's effective. So it's kind of hard to get it like down into your scalp without a lot of it getting on your hair, and then you're kind of wasting it. So it's just kind of a messy and annoying to have to apply it every night. And so I kind of gave up on it after like a week. And at that time, my hair loss wasn't super significant. So I didn't feel like it was like a huge urgent thing that I needed to fix right then. And so I just thought, well, I'll just talk to my doctor the next time I see him, and maybe I'll talk to him about options of what I can do for this. But unfortunately, around that same time was when the legislation was going into effect in Florida that was basically blocking gender-affirming care and making it much more difficult to access hormones. And so I had been seeing the nurse practitioner at this practice to get my testosterone and other related medications and things and treatment. And because of the new law, I had to switch to seeing the actual doctor there. You can't see a nurse practitioner anymore in Florida, and also you can't do telemedicine anymore in Florida, which is how I was doing it for most of the time, like the last several years, because I live probably 35 to 40 minutes away from the doctor's office, and it always just, for whatever reason, always just takes forever at this doctor's office. I'm usually there for at least 2.5 hours. It's just like an all-day thing whenever I have to go there, so it's really a pain. So I don't like having to go there, and I loved having telemedicine for that reason, but I couldn't do that anymore because of the law. So I had to actually go to the office and had to actually see the doctor. And of course, now the doctor was having to take on all of the patients that had previously been seen by the nurse practitioners, which was almost all the HRT patients there. And so he was swamped, and so my appointment got pushed back. At this point, I was cutting my T-dose because I was worried about it not lasting long enough, and I was worried about it getting cut off. And so anyway, by the time I was able to finally go see him, I was just really anxious about just getting my tea refilled and making sure I could stay on it and meet the criteria of the new laws. And so I didn't want to ask for anything additional because I didn't want to complicate things. So at that time, I didn't want to ask for Finasteride, which is what I thought was probably going to be the treatment of choice. And I'm also going to get more in-depth into Finasteride in a little bit. But basically what it does is both block facial and body hair growth as well as scalp hair loss. I had previously asked the nurse practitioner that I saw for if I could take Finasteride. Well, I wanted to get on it because I wanted to block facial and body hair growth because I didn't want that. This was very early in my transition, and it was when I was just starting to get facial and body hair, and I didn't want it, and so I really wanted to go on Finasteride to see if I could block it because I had heard of other trans people doing that, and he didn't want to do that because he basically felt like that was not what it was meant for, and so I kind of gave up on it after that. So that was part of why I was maybe a little more hesitant to ask for it again, even though it was a different provider, but it was the same practice. So I figured I'll just wait until my next appointment, which I see this doctor every 3 to 4 months, because I have to get, that's one of the other things with tea, because it's a controlled substance. I have to go get labs done every 3 to 4 months and go back to this doctor. So anyway, I figured I would just ask him the next time I saw him, because at that time my hair loss wasn't super significant. It was just kind of I was noticing it, and so I wanted to do something about it, but I didn't think it was a huge, urgent thing that I needed to fix right then. Unfortunately, that was not correct. I wish that I had been able to get on finasteride then, but instead I waited, and during that summer, last summer of 2023, I still had like a decent amount of hair. It's just that it was thinned out a lot, and like I said, I didn't realize that was because of hair loss. I thought it was just because of my haircut. So in 2023, that's still how it was. I don't know, I just didn't feel like what I thought hair loss would feel like the experience of it, what it would look like, and what it would, like, how I would notice things. That's not what I expected hair loss to be like. I thought that it would be, like, very obvious, and that I would, like, notice it, like, moving, like, my hairline moving back very clearly, where it would be, like, bald here all of a sudden, and that it would be the same thing on the top of my head, and that's really not how it was. It was just, it would thin out so much that, like, it wasn't noticeable for a really long time. And so that was still how it was during the summer of 2023. Here's a video that I made in June of that year, and just at this part you can see me kind of like put my head forward, and there's still a decent amount of hair there. But over the next couple of months, I noticed that every video I took of myself where I was showing the top of my head, whether I was like bending down or it was just like the way the shot was, had the top of my head on it, I started to notice that there was like a big, like, bright area that was not covered in hair, really. I could see my scalp more than I could previously. This video in particular is one that I made. I made this little tripod mount thing for a mirror, and when I made the video of that, like, when I watched it back, I was like, oh my god, like, my hair is completely thinning in the back. I have this enormous bald spot, and I was just, like, horrified by it. Luckily, around that time was when I went back to my doctor and was able to get on finasteride finally. So I started finasteride in September of 2023. So I'm going to pause here and just explain what finasteride is and, like, how hair loss kind of works. And this is going to be very basic because I'm not an endocrinologist, I'm not a scientist, I'm just explaining my understanding of how this works. So basically, hair loss is not caused by testosterone directly, but it's caused by DHT, which is something that testosterone converts into in your body. And it's normal for it to convert into DHT, not all of it, but just some of it. And DHT is the reason for certain things such as hair loss on the top of the head, hair growth in other places like the face and body, and it also affects the prostate in people that have one of those. It also affects bottom growth. Part of the process for testosterone converting to DHT is an enzyme called 5-alpha reductase. And there are 3, like, subcategories, I guess, of that enzyme. And there are 2 drugs, one is called finasteride, one is called Dutasteride, that both inhibit these enzymes. And finasteride works on 2 of the 3 enzymes, or subcategories of the enzyme, and Dutasteride works on all 3 of them. Dutasteride is not FDA approved for hair loss, whereas finasteride is. So finasteride is kind of the main, like, treatment that is used for this this inhibition of 5-alpha reductase. Although Dutasteride is also used, but it's like an off-label kind of thing. So basically the way finasteride works is it blocks DHT from being created from your testosterone, so it prevents the effects of DHT on hair loss. And it also can affect the effects of DHT on hair growth in the rest of your body. Anybody can take this drug, but it is, like, kind of the mainstream use of it is for cis men. It's very common for people that are treating hair loss to take it. It is available in an oral form as well as a topical form. And the way that it works is basically it's because it blocks DHT, it prevents further hair loss for the most part. That's mainly what it does. Some people experience hair regrowth on it, but it kind of depends, like, how quickly you get on it after you've started to lose your hair, and other factors. Like, it just kind of varies from person to person. But the main thing that you can expect from it is hopefully that it will prevent further hair loss. So I was hoping I would get regrowth on finasteride, but unfortunately that doesn't seem to have happened. But it did basically stop, or at least significantly slow down the progression of hair loss that I was having. So it kind of halted things. And so basically the amount of hair loss that I had in September of 2023 was pretty much the same by September 2024. This isn't a perfect comparison because my hair is a little bit longer in the second shot and also a little bit darker because I just dyed it for DragonCon. So the contrast is a little bit different, but I think it looks pretty similar as far as the amount of hair loss that I had on the top of my head and at the hairline. Finasteride takes several months to take effect at all, and they say to give it a year before you can really say for sure whether it's working, which is very frustrating, by the way, if you're dealing with hair loss, that you have to wait a whole year to figure out if this treatment is working before you do anything else, because during that time you feel like you're like racing against the clock for losing more hair. But anyway, so I wanted to give it that time, and I didn't want to kind of complicate things by adding Minoxidil, because then if I got hair growth on that, then I wouldn't be able to tell what the Finasteride was doing. So I tried to be patient, and I did make it through the whole year. I didn't really notice any hair growth from Finasteride, but I felt like maybe it was at least slowing things down. But after that year was up, this past September in 2024, I was really having a hard time with my self-image, I guess, because of the amount of hair loss that I experienced. And even though it wasn't really worse than it had been a year before, it was just really demoralizing that I had been taking this drug for a year and it wasn't any better. And also just seeing pictures of myself at DragonCon, I hated how I looked, and I just was at a point where I felt just disgusting and just felt really, really bad about myself, not just physically, but I felt kind of hopeless about my entire life, basically, not just because of the hair loss, but just that was part of it, where I just felt like everything that I was doing was I don't know, it was just a bad time, basically. And the hair loss was kind of compounding things because I just felt really bad about myself physically, and I felt I just felt disgusted by myself every time I saw myself in the mirror or in a picture or anything, and I felt like I can't do anything now without feeling self-conscious, and it's just, I don't know, it was just really bad. And I just want to clarify, when I say that I felt disgusting and hated looking at myself with the amount of hair loss that I'd had, I'm not, that's just about me. I don't look at other people who have had hair loss and think they look disgusting. I'm not saying you look disgusting if you have had hair loss. It's just about how I feel about myself and how I see myself. And yes, of course, there are cultural and societal aspects of that. I mean, I'm sure I've been influenced by society in that respect, but it's also just my hair was I was kind of vain about my hair, to be honest. I felt like it was one of my better features, and I spent most of my younger years, my adolescence and early adulthood, hating my hair. I didn't like how it was when I had it longer and was trying to be feminine, and I never knew how to style it, and I never knew what to do with it. And when I finally cut my hair and started styling it short, I finally felt like I could style it in a way that I was happy with, and I just felt really good about it. I felt like it was something that was I don't know, I guess part of my kind of self-identity, in a way, because it was just a big part of my early transition, and I don't know, it was just a lot of stuff like that. Also, I'm genderqueer. I'm not male. I don't want to look male. I don't want to be male. And how I was starting to feel about my hair was really what can only be classified as dysphoria. It was gender dysphoria. It's just that it was coming from the opposite direction that my gender dysphoria had come from previously. And I just was starting to feel very out of alignment with myself because of the hair loss that I was having. And I don't know, I think that's why it had such an impact on me. I mean, aside from just feeling like I didn't like how I looked, but a big part of that was because it didn't feel like me. It didn't feel like how I looked, how I was used to looking to myself and how I wanted to look to myself. And it just felt like my body was betraying me, I guess, in a similar way to how it had felt in other ways. from dysphoria. So I just wanted to clarify that because I don't want anybody to think that I'm insulting them or even projecting this onto anybody else. I'm really, like, this is really just about me and how I felt about myself in my body. So at that point, I was like, I really don't care, like, about science anymore. I mean, I don't care about science, but, like, I didn't care about confounding variables, I guess, and just wanted to, like, throw everything that I could at this issue to try to fix it. So at that time, I did start taking foam minoxidil, which is a little better because it dries, whereas the liquid is just kind of greasy and it's just, like, stays on your head. But the foam goes on like it's a foam, it goes on wet, but and it still has kind of the same issue of, like, trying to get it into your scalp without getting on your hair. But once it's on there, it does dry, and so it's not as bad as the liquid. Once I started using it, and I was using it every night, I still had to switch to washing my hair, like, every other day as opposed to, like, every 3 to 4 days, which is what I was doing before, because my hair doesn't really get that dirty most of the time. So that's been inconvenient, but other than that, it's been, like, okay, I guess, using it. It's a pain to use it, but I decided to just trust the process. And so the first month that I was on it, I lost a lot of hair, which is very common because of the way that minoxidil works. It increases blood flow to your scalp, but what it does basically is it accelerates the hair cycle, which is basically when you have hair growing in a certain place, it eventually falls out and then new hairs come up in the same, like, spot in your scalp, or this is also the same all over your body. So your hair is always in these, like, different phases of, like, new hair growing up under the skin that's, like, ready to come up once you lose the hair that's already there, and it's just, like, always, like, in a process, and it just happens cyclically, and it happens, like, that cycle is different in different parts of your skin, so it doesn't appear like you're, like, losing all your hair at once. It's always kind of cycling through. So minoxidil kind of accelerates that process, so what happens is you lose a lot of hair quickly because the new hair is trying to come out, and so there's this shedding phase that's kind of talked about, which is common pretty frequently within the first month, but it can happen even after that. It can be, like, a few months. And I experienced that, but I didn't notice it shedding in the sense of, like, my hair was falling out everywhere. I mean, I did notice that, but, like, my hair was already falling out all the time. I have, like, even before I started losing my hair, I've always had a decent amount of shed, like, in the shower. Or I shouldn't say always, but definitely for the last, like, many years, like, even before I went on T, I lose a lot of hair in the shower, and, like, whenever I dry my hair, it's just, like, hair everywhere, and it's just a lot of hair. But because my hair is short, luckily it doesn't, like, cause a big problem most of the time. It's just, like, kind of annoying to clean up. But it's not like it was coming out in clumps or anything. It's just whenever I would, like, mess with my hair, like, hair would come out. But like I said, my hair was so thick that it didn't really matter if I lost a decent amount in the shower because there was always so much more there. Once I started losing my hair, it became more of a problem. But anyway, like, when I started shedding on the minoxidil, it wasn't like it came out a lot more necessarily. I mean, maybe there was more in the shower, I don't know, but it's just that, like, I definitely noticed that my hair was even thinner than it was before. So the first month that I was on it, things got worse before they got better. So here's a comparison of when I started taking it versus a month in. And I also, because of what I just said about that I've always kind of, or that I've for a long time have had a lot of hair loss, I decided to also go back on iron supplements because iron deficiency can also cause hair loss. And I didn't really feel like I was experiencing other symptoms of iron deficiency. And I have gotten my ferritin and iron panel checked pretty frequently over the last several years because I did have a very significant ferritin deficiency, or iron deficiency, but, like, it showed up as low ferritin several years ago. And so I've been monitoring that pretty decently. And what happens is, like, it'll be low and then I'll go on supplements and then it'll go really high. And so then I have to kind of go off supplements, and it's been a little bit hard to balance, but I had been off iron supplements for a while, and my ferritin was still in like a decent range the last time I had it checked, but I was like, well, maybe it's like low for me, so I went back on iron supplements at that time. I also started using this shampoo, conditioner, and like leave-in treatment called Nioxin, which is kind of expensive. It's like $50 or something for all three of them, and it's supposed to also increase hair growth. It's not a medication, but it's like it has like caffeine and like mint and like other stuff that's supposed to like increase blood flow and like, I don't know, all this other stuff. I wasn't like super confident that it would do anything, but at that point I was pretty desperate, so I was like, whatever, I'm just gonna like do as much as I can at the same time to try to get hair back and like whatever. So also at the same time, I decided to go off of tea for a brief period. Basically, my thinking on this was to, it's not that the goal was like to go off tea to get hair back from being off tea necessarily, but just to prevent further hair loss, again, because testosterone gets converted to DHT, so I was kind of thinking like maybe if I just stop taking the testosterone, that'll kind of like halt the further hair loss that's caused by the conversion to DHT. Again, it's not something I like was certain about, but I was like, whatever. And I also had already, I don't know why my light is flickering, sorry if you can see that. And I've also kind of been thinking about going off of tea for some period of time because I have basically lost the ability to cry, and that seems to be related to being on tea. It's something that a lot of other people have experienced, although not everybody experiences that. But I was hoping that maybe if I went off tea, maybe I would be able to cry and like get some emotion out and like just have like a little break from it. So I went off of it for about 2 months, a little over 2 months. And unfortunately, I still never was able to cry. And I'm not sure what effect it had on my hair. But anyway, I had to like go back on it after that period because my menstrual cycle came back, and that was horrible, and I just couldn't deal with that. I had to deal with it twice, and that was enough. So anyway, I went back on tea. So the first 2 months that I was on Minoxidil, I was off of tea. And the third month, I was back on it. So here's what my hair looked like after using the foam Minoxidil for 2 months. And at this point, I was definitely starting to see some regrowth, and I was getting very much more encouraged by using the Minoxidil, although I was kind of annoyed that, not that I wasn't annoyed that it worked, but it was kind of like, oh, okay, now I'm going to have to take this for the rest of my life, so that's great, but it's a little annoying, but I was very encouraged by that. I think the comparison is the most obvious when I look at the crown of my head, but also on my hairline, it's pretty significant the amount of regrowth that I've gotten. It's still very thin in that area as compared to the area around it, but it's definitely starting to fill in a lot, and so that's encouraging. But like I said, it's annoying to use, and so I wanted to switch to oral Minoxidil. And the reason that I didn't want to take that before is because it's systemic, and so it can cause hair growth all over the rest of your body. And so I was kind of hesitant to use it for that reason. But then I was thinking about it, and I realized that because the way Minoxidil works is that you have to be taking it for the hair to, like, your hair growth to maintain. If I started to get hair growth anywhere else, I could just stop taking the oral version of it and it should revert back. So there wasn't really like a big risk of taking it. So I started taking that in November, and I continued using the foam Minoxidil also, but not every night. Instead, I switched to doing it like every 2 or 3 nights. The idea there is to kind of overlap the two treatments so that just to make sure that I don't get any shed from switching, and just like to make sure that the oral Minoxidil has like time to take effect. So at some point I'm going to like taper off the foam Minoxidil entirely, but I just wanted to make sure that the oral was working first, and it seems like it is. It can lower your blood pressure, and I already have fairly low blood pressure, and I have noticed at the gym, especially running the last few days, that I feel like I am struggling a little bit, so I'm wondering if it's because of that, or possibly because of that combined with some other things. So I'm going to experiment a little bit with the other things and like supplements and stuff, and see if maybe I can get that under control. Hopefully I will be able to, because it's definitely a lot more convenient taking the Minoxidil orally than having to apply it to my head. But if I have to switch back, I mean, at least I know I have that option. But yeah, we'll just have to see on that. And during that second month, when the shedding stopped, I actually have noticed less hair in the shower and on the floor and everywhere else than I had previously. So I'm not sure if that is from the minoxidil itself, if it's from taking iron again. Probably not, because I was taking iron like in previous years and was still losing hair. But anyway, I don't know exactly what it's from. It could be a combination of those two things. But at this point, I still am losing some hair in the shower, but it's not as much as it was. So that's a plus. I have continued to get more regrowth over the following month. So here is my hair after 3 months on minoxidil, which is the first 2 months on the foam minoxidil and then the third month on foam and oral. Again, I think the crown of my head is the most noticeable area, but also a little bit more in the hairline. And I still have a decent amount of thinning in the top of my hair, so I still have some like kind of bald patches, and overall I still have way less hair on the top of my head than I used to. I probably lost like half of my hair when I started to get hair loss that was noticeable. Like at the time that I started Finasteride to begin with, I probably had lost like half of my hair, and that's not an exaggeration. I had so much hair to begin with that it luckily like wasn't as noticeable, but yeah, I lost a huge amount of hair. But because I didn't really get any regrowth on Finasteride, even though it seemed like it was kind of working, I was a little paranoid that maybe it wasn't completely stopping the hair loss from happening. And so I wanted to try switching to Dutasteride, which is, because it works on all 3 of the subtypes of the enzyme, it can be more effective. Some people get regrowth on it when they didn't get regrowth on Finasteride. I've also seen some people say, and this is mainly cis men that I'm talking about, because that's mainly who is talking about this online in like big forums like on Reddit and stuff. I've seen some people say that they lost a lot of their body hair, so that would be really nice. So I wanted to try switching to Dutasteride, but like I said, because it's not technically FDA approved, it's a little more tricky. Like it's like very frequently prescribed for hair loss. It's not like unknown or anything, but I just like wasn't sure if my doctor would like know enough about it, or like I don't know, I just was like a little nervous about it. But thankfully I saw him earlier this week and he agreed to switch me to Dutasteride. So I've only been taking it for like 2 days so far, but so far so good. And so I'm hoping that it will lead to more regrowth, but I'm at the very least hoping that it will do as well as the Finasteride did. Luckily, I didn't really get any side effects from the Finasteride, so I'm hoping that'll be the same with the Dutasteride, and that it'll work even better. And so that'll be, I guess, for a future video, I'll be able to talk about what effects it has had, if any. But for now, that's where I am. I'm feeling encouraged by the amount of hair regrowth that I've had from the minoxidil and from stopping the further hair loss, or at least slowing it down from the Finasteride, and hoping that the Dutasteride will do even better. So I'm feeling a lot better now than I was a few months ago. I'm still like frustrated. I'm still like kind of annoyed and resentful that I had to get to this point, because if I had just been able to get on Finasteride to begin with, this wouldn't have happened. But anyway, there's nothing I can do about that now, so I can be angry about it and bitter about it, but there's nothing I can do other than just try to treat what's going on now. So that's what I'm doing, and I'm feeling much better about things, hoping that this is like not going to be just as far as it gets. Like I'm hoping I'm going to continue to get more regrowth. I don't know that I'm ever going to get back to where it was before, because it was very thick before, and that's a lot of hair that I would have to regrow, but that's the dream, I guess. So yeah, I think that pretty much covers up to where I am now. If you have any questions, as always, you can leave them in the comments below. Give it a thumbs up if you liked it, and subscribe to see more of my future videos. Thank you so much for watching, and I'll see y'all next time.